This section covers disorders of the adrenal gland. The adrenal glands are located on the top of each kidney. Each gland has an outer cortex and an inner medulla. The adrenal cortex produces three types of hormones: glucocorticoids, mineralocorticoids, and sex hormones including androgens and estrogen. The medulla produces epinephrine and norepinephrine, which are best known for their function in the fight-or-flight response. To understand the consequences of having too much or too little of the adrenal cortex hormones, it's important to first know what they do. You may remember glucocorticoids such as cortisol as a hormone that helps the body to cope with stress. Cortisol has many functions. It regulates the metabolism of carbohydrates, proteins, and fat. It also suppresses the immune response and decreases inflammation. Mineralocorticoids such as aldosterone play an important part in maintaining your blood pressure. When your blood pressure is low, aldosterone is secreted to increase sodium and water reabsorption at the kidneys. When sodium is reabsorbed, it is exchanged with potassium, so aldosterone increases potassium excretion. The sex hormones help to maintain the secondary male or female sexual characteristics. Let's look at Cushing's syndrome. Cushing's syndrome occurs when there are excessive glucocorticoid hormones in the body. The number one cause of Cushing's syndrome is taking too much glucocorticoid medication. This may happen to people who have inflammatory conditions who are taking glucocorticoids to suppress the immune system. Another cause of Cushing's syndrome is overproduction of ACTH by a pituitary tumor. Excessive ACTH would stimulate the adrenal cortex to produce large amounts of glucocorticoids. A third cause of Cushing's syndrome is an adrenal tumor that secretes excessive glucocorticoids. In Cushing's syndrome, a collection of signs and symptoms usually occur together. There is accumulation of fat tissue in certain areas, the abdomen, behind the shoulders, this is known as buffalo hump, and on the face, this is known as moon face. On this person's abdomen in the picture, you can see purple striae or stretch marks. Hyperglycemia means high blood glucose levels. You can also see that the arms and legs are thin. This is because cortisol has catabolic effects on muscle and adipose tissue. This can result in muscle wasting, weakness, and difficulty in movement. Loss of collagen results in thinning of the skin, and the capillaries become more visible. Small blood vessels can also rupture and cause bruising. Mood changes can occur, for example, from euphoria to depression. Osteoporosis causes bones to become weaker. This drawing summarizes the signs and symptoms of Cushing's syndrome. To treat Cushing's syndrome, the cause must first be identified. If Cushing's syndrome is caused by long-term corticosteroid medications, then the treatment will be to slowly taper the dose of the medications. If the cause is a tumor in the pituitary or adrenal gland, then the tumor may be removed by surgery or radiation. Another disease related to the adrenal gland is Addison's disease. Addison's disease is rare, but it can be life-threatening. In Addison's disease, there is undersecretion of hormones from the adrenal cortex. This means the body has insufficient glucocorticoids, mineralocorticoids, and androgens. It is caused by damage to the adrenal cortex. Autoimmune disease is the most common cause. Addison's disease usually begins gradually. The lack of glucocorticoids leads to several signs and symptoms. The person experiences chronic worsening fatigue. Gastrointestinal symptoms may occur, such as anorexia, which is low appetite, nausea, vomiting, and diarrhea. Hyperpigmentation of skin and mucous membranes. Due to the lack of glucocorticoids, the pituitary gland secretes excess ACTH. ACTH also stimulates the production of melanin, and this causes the skin to become darker. Hypoglycemia, which means low blood sugar. Weight loss. The lack of aldosterone leads to decrease in sodium and water reabsorption in the kidneys. The loss of water can lead to hypotension and dizziness. The loss of sodium leads to hyponatremia. Since potassium is not excreted in exchange for sodium, this leads to accumulation of potassium in the blood or hyperkalemia. These photos show the hyperpigmentation caused by Addison's disease. As expected, areas of the skin that are exposed to sunlight will be more pigmented. However, in Addison's disease, hyperpigmentation can also show up in unexpected areas such as the creases on the hands and even in the gums. Sometimes the pigmentation can also be uneven. The treatment of Addison's disease involves replacement of hormones. Cortisol is replaced with the drug hydrocortisone or prednisolone. Aldosterone is replaced with the drug fludrocortisone. What about androgens? Some women may receive androgen replacement. Men who have Addison's disease do not need androgen replacement because their testes are also able to produce testosterone. In this section, we have covered Cushing's syndrome and Addison's disease. Before moving on to the next section, try to recall their etiology and signs and symptoms.